deforestation. They're climate neutral certified, and every product is fully recyclable. How amazing is that? Outer is made from the best materials. Their patented outer shell fabric is UV protected and stain resistant, so it keeps things looking brand new for up to 10 years. Plus, the all-weather wicker and rust-proof legs makes them the most durable outdoor furniture brand. Plus, it's extremely comfortable too. And finally, Outer is risk-free. If you don't love your Outer sofa, they offer free return shipping and 100% money back guarantee within 14 days of shipping, but mine is staying put right in my backyard. People love Outer. They make the most durable, eco-conscious outdoor furniture. Plus, they're an amazing brand that actually gives back to the environment. If you're looking to live better outside, look no further than Outer. Don't wait. Get $200 off and free shipping by going to go.liveouter.com/MadiASMR. That's go.liveouter.com/MadiASMR so they know I've sent you. One of their recent collections sold out within 24 hours, so trust me, you don't want to miss anything. Thank you so much, Outer, for sponsoring this video. Okay, sweetheart. So I'm sure you're a little confused as to why I brought you straight on back here instead of you seeing the receptionist when you come in as you normally would. She is actually out sick today. So if you don't mind, I am just going to be doing intake right here in the exam room. And by the way, my name is Madi. I will be your nurse today. Nice to meet you. Okay, perfect. So I'm going to start you off with a patient intake form. Okay, just some general information here. I want you to fill everything out as best as you can, except for this insurance information. If you have your card on you, I'm just going to scan it real quick. It'll be 10 times easier. Okay, perfect. So let me hand you that. Do you need a pen? Okay. There is that. I'll set that here on this table for you. Okay. So just fill that out for me. And you have your insurance card. Perfect. Thank you. So place it here. I know it's been raining outside all day. It's actually kind of relaxing. I know. Alright. It's like my favorite weather to sit down and read in. Okay. Alright. Here's your insurance card back. Thank you so much. Okay. Alright. And have you been to see us before? No, okay. That's what I thought. Okay. Just like to always make sure, because then if you're not a new patient, then we would skip a lot of steps. Okay. Alright, are you done with your form? You are. Thank you. Okay, so I'm just going to enter some of this information in here. Set this right here. Just a little bit of it, and then I'll enter the rest in later. just your basic information like your name and date of birth. Okay, so your primary care physician is May, Dr. May, at Bloom Better Care. Okay. Alright. Date of birth 3/26/1996. Magnolia. Okay, email address. Flowers at 222. Flowers 222. gmail.com. Okay. Alright, so let's see. I fell and hit my head while gardening and have had lightheadedness, a little dizziness, and fatigue that started 3 days ago on the day of the fall. Okay. You began feeling sluggish about a month ago. Okay. But symptoms increased at the fall. Okay. Alright, so set that over there so that I'll remember to enter that in later. Okay. And I'm just going to send a quick message to Sarah. She's going to pop in and do a blood test real quick. And we should have the results for that by the end of our appointment. Alright, so I'm going to ask you a couple questions before the doctor comes in. We'll do a couple tests. Okay, so are there any events before the injury that you have memory of? Okay. Are there any events just after that you have memory of? Okay. Did you lose consciousness at all in the fall? Okay. Okay. Were you dazed or stunned? Confused about events? Slow to respond? Okay. Are you repeating things at all? Okay. And did your primary physician, did she see you already for this? No? Okay, she just referred you over the phone. Okay, good to know. And I know you said you didn't see us specifically before, but have you ever been seen by anyone for a concussion before? Ever been diagnosed with a concussion before? No? Okay, good. Alright. So, you said you were dizzy. Are they reoccurring? Is it every day since the fall? Do you have hearing loss that you've noticed? Okay, ringing in the ears. Okay. Alright. Are you taking any new medications? Are you on any medications? Okay. Do any of the following movements make you disoriented or dizzy? Okay, moving side to side. No. What about up and down? Okay. Suddenly stopping. Okay. Does standing up or sneezing, anything trigger your dizziness? Have you noticed? No, okay. Sometimes when you stand up. When it's fast only, okay. Like every time, is it at a certain time of day? Okay. Okay. How long has that been going on? Okay. Alright. Have you been seen previously for vision care? Okay. Do you have contacts on right now? Okay. Any surgeries recently? Perfect. Any smoking, drinking? Okay. Okay, alright. And we have your goals already. We have your emergency contact information. Okay. Perfect. Okay, so now I'm going to listen to your heart rate quick. Okay, so I'm just going to place the stethoscope right on your chest here. Just take a deep breath for me in, out. Okay, in, out. Again, in, out. Okay, so your heart sounds good. Now I'm just going to get a heart rate here quick. Perfect. Okay, and then going to get your blood pressure. Okay, so I'm going to wrap the cuff around the arm that Sarah didn't just do the blood test on. So, okay, wrap it here. Perfect. Get my stethoscope back on. Alright. Perfect. Put that back there. And let's get that Okay, so I'm just going to make a quick note about your blood pressure for the doctor. Okay. Alright. Okay, so you are ready to see the doctor. I'm going to go get her and she should be in just a few minutes. Alright? It was so good to meet you. I hope you start feeling better. Hello there, sweetheart. I'm Maddie. I will be your doctor today. Just get my gloves on here. So, let's see. It looks like you fell and hit your head while you were gardening. Yeah. I'm so sorry to hear that. You've been experiencing lightheadedness, a little dizziness, fatigue, starting after the fall. Okay. But you've been feeling sluggish for about a month, but the symptoms increased at the fall. Okay. Alright, so as I'm sure you know, I specialize in concussions, which is probably why your primary physician referred you to me. So I just want to explain to you kind of what I'm going to be looking at here with your brain. Okay. So this is what your brain looks like. And what a concussion is it's a traumatic brain injury, or a TBI. So what happens when you fall, or there's some sort of impact, whatever it may be, is your head and brain rock back and forth like this. So it may be hitting something, but regardless, the head and brain are rapidly moving back and forth, okay? So what this does is this stretches and damages the brain cells, and this creates chemical changes which makes it more sensitive to injury or stress until the brain is fully recovered. Okay? So, I always just like to give that little demonstration I find when I have patients come in. It just helps it to make a little bit more sense. Okay. We got some blood work done, it looks like, as well. You saw Sarah? Good. Perfect. So, I'm gonna go ahead and just start by checking your reflexes. So if you want to scoot towards me just a little bit with your legs dangling off of the table, but the backs of your knees right against it. Perfect. So just stay still, let them dangle. I'm just gonna check your reflexes fast. In both legs. Perfect. Okay. Now I'm gonna check your eyes. First, I'm just gonna look at the overall health of them. Just the coloring. Okay, now I'm gonna check your dilation. So just stare straight ahead as I pop this light in and out. Good. Alright. And you haven't had any problems with your vision, right? Okay. Real quick, I'm just going to confirm that your vision is okay. So, with both your eyes uncovered, will you read above this black line for me? Perfect. Okay. Okay, so same thing, just below the black line, and I'm just going to cover your eye. Go ahead. Perfect. Okay. Other eye, can you read above the red line? Perfect. Okay. So, eyes are good. And we already looked at your memory. You seem pretty alert, which is a good sign. Reflexes are good. And balance. Would you mind standing up for me quick? And just standing on one foot. Good, you can stop and switch to the other leg. Okay, go ahead and sit back down. Okay, balance looks to be normal. And finally, I just want to do a hearing test. So far you haven't failed any of these tests, but if you do, we will do a CT scan and some more in-depth concussion testing, but so far it's looking good. So let's check your hearing and then I'll take a look at that blood test, alright? Okay, just look right at me and I want you to tell me which ear you hear sound in, okay? Perfect. Good. Yes. Good. Alright, so hearing is good and it's not quiet or anything. Everything is normal. I'm just going to look in your ears here really, really quickly. I think everything's fine, but you know, we just want to be really thorough here. Yeah, everything's looking normal. I don't see any redness or inflammation or anything like that. Okay. And do you have a bump on your head from the fall? Where is it? Right here, just right on the top. Okay, do you mind if I look? Okay, I just want to make sure, because I'm sure it's a little sore. But I promise I will be extremely gentle. Okay, yeah. I can feel a little bit of a raised bump. It looks to be just a little red, but I can see a little bit of bruising just on the scalp here. Okay, I'm just going to measure it really quick. I just want to make sure, because if it's getting bigger, that's something we need to know. Okay, this way too. Okay. Okay. All right. So let's take a look at this blood test because your concussion test is normal. So, and if you had a concussion, you would definitely be showing signs of it in these tests. So, pull this up here. Okay. Scroll down. So, everything on your blood test looks normal except for your iron levels. They are quite low, which is a concern. You are likely iron deficient, anemic. Yes, and I would be willing to bet that was what caused your fall. It's probably due to a lack of iron in your diet. So what I'm going to do is I'm going to prescribe you a special iron prescription dose because you're going to need to do some higher doses for a little while just to get you back to normal levels. So I'm going to enter that into the system. And I'm going to enter your diagnosis into the system. So I want you to do a couple of things. Start taking this iron today, for sure. And then I want you to watch that bump. If it gets bigger, come back. Give us a call. If there's any changes, anything worsens, new symptoms pop up, give us a call. Okay? Perfect. Okay. That is put in. So